So guys, women, okay? Today we want to talk about types of discharges and what they mean. When you start seeing a discharge, it's like your body is trying to tell you something. It's trying to communicate. And it's just better if at all you listen to what it's trying to communicate, all right? So we're going to start with the normal type of discharges and then we go to the abnormal types of discharge. Now, a clear or a white type of discharge that does not have smell with a noticeable or slight smell, that is a normal type of discharge. Another normal type of discharge is brown type of discharge. It can be either dark brown or light brown, okay? This mostly happens during the beginning or the ending of your menses, all right? It's like your body is trying to clean itself. I've been saying this a couple of times, all right? That the uterus and the vagina usually have their own way of cleaning themselves. So once you start seeing a brown type of discharge, either at the beginning or at the end of your periods, it's very normal, okay? It's just an indication that your organs are trying to clean themselves. Another type of normal discharge is a clear watery. Sometimes it might be stretchy or sticky, depending, okay? Once you're ovulating, you might have a clear, watery or sticky or stretchy type of discharge, very normal during ovulation, okay? Or at times when you're pregnant, or at times when you're sexually aroused, okay? You might have a clear watery type of discharge that increases in the amount, okay? So anytime you see a clear type of discharge that does not have smell or that has a slight smell, okay, that is unnoticeable, that is very normal. Clear, watery type of discharge. It can either be sticky, it can either be stretchy or increased in the amount. Very normal. It happens during pregnancy, it happens during sexual arousal, it also happens during ovulation. Now, I need to emphasize this, all right, that sometimes in pregnancy, you might experience a white type of discharge. It's called leukorrhea, okay? It's often thin, milky white, with a mild smell or sometimes odorless because of the increased levels of estrogen and progesterone. But if you start seeing a thick and lumpy type of discharge that resembles cottage cheese, that might indicate yeast infection, especially vulvovaginal candidiasis, also known as thrush, and you need to be helped. There's a difference. And I need to emphasize this, that during sex, okay, if you're a woman and you are having a type of discharge that is white and it's clumpy, all right? Most of you call it that mayonnaise or something, all right? And has a bit of smell. That is not normal. It's not mayonnaise, whatever you're calling it. It's not that you're sexually aroused to the latter. That is infection. Anything that is clumpy and has smell is not normal, all right? As I've told you, during sex, the type of discharge that you're supposed to have is either clear, watery, or mild whitish, okay? That does not have smell. Anything that has smell and is way too clumpy, that is infection. Another normal type of discharge is pink, all right? This might indicate implantation bleeding. It means you're pregnant and implantation is happening. Now, before we get into the abnormal types of discharge, how about we talk about spotting in women? Why do spotting happen? Women might experience spotting or light vaginal bleeding due to a couple of reasons, including hormonal fluctuations, especially if at all you're trying to change from one birth control method to another, or you're starting any type of birth control as long as it's hormonal, you tend to have spotting, okay? It causes hormonal fluctuations, that's causing the spotting. Another reason to why you might spot is during ovulation, because there's a drop in estrogen levels, okay? That's causing the spotting. Another cause of spotting is pregnancy, right? Especially during this implantation period, whereby the fertilized egg is trying to attach itself in the walls of the uterus, all right? So once it's trying to attach, you'll get some bit of what? Of spotting. So every time you see spotting, just so you know, and you had sex, you might be pregnant, you might be ovulating, or you might be having fluctuations in your hormones, all right, causing the spotting. The last one is if at all you are in your menopause phase and you start seeing spotting, that might indicate something serious and you need to see a doctor. Now, let's get into the abnormal types of discharges. Okay, the first type of abnormal type of discharge is a whitish gray type of discharge with a fishy smell. That might indicate bacterial vaginosis. Another type of abnormal type of discharge is white clumpy type of discharge, all right, that is being accompanied by either a vaginal thrush or itchiness. Okay, that might indicate yeast infection. And the last one on my list is either yellowish or greenish or a combination of both. okay? Especially if it's accompanied by itchiness, a painful urination, and also a foul smell. That might indicate an STI. So it's very, 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 very wise of you to go seek medical attention. As I said earlier, that a discharge is your body trying to communicate. Please listen very carefully, okay? There are a lot of discharges out there, okay? And I've just tried to make a blurb, a summary of what are very, very common, okay? So for more type of discharges and more videos like this, please follow me at Mackenzie Ule Moja, pale YouTube, okay? Support, subscribe. You'll get more videos and you'll learn a lot. Mackenzie Ule Moja. I want to make something a bit clear, all right? That how we treat infections in pregnancy is kind of different of how we treat infections to people who are not pregnant, all right? And I'm going to make a video on that. So if at all you have recurrent infections, if at all you have problems with your discharge, if at all you have issues with your discharge, please feel free to text me. My number is on my bio. Just DM and you will be helped. All right?